to relax and to exercise. And when, to take a lot of liquids, this time it's very important to hydrate. And I think that's one of the most important things, is to take care of yourself and take care of your loved ones. To be attentive, if there's anything that comes up, to come and ask questions.
You mentioned something about social determinants of health. If you could explain a little bit more about that.
Yeah. When you look at health, everyone thinks that you get ill at one point in time. But it really is multiple things that impact your health. And a lot of that has to do with even when we're growing up. And I think that's why one of the importance of early childhood, because those are critical times in life. So how you deal with stress as a child will impact how you deal with stress as an adult. So those are important pieces. Your nutrition that you had as a child will impact your health in the future. So when you look at those, what are those social determinants of health? It's not only the food that we eat. It's not only it includes the family that we grew up in. It includes some of the experiences that we had as a young child. It's our education level. We do know that the higher your education, the healthier you are. Some of it has to do with where you live. We know that rural communities are at greater risk for health conditions because they have limited access. Some of it has to do with your own culture, because you may not reach out for health care. And so we have to deliver health care differently. We maybe need to reach in rather than reach out. One of our important programs that I can talk about that we've received awards is the Healthy Start Home Visitation Program. And I think that's a perfect example of looking at the social determinants of health. We want to improve the health of a child. But what are we working with? We're working with the relationship between the mother and the father and the child. We're working with assuring that that child has early childhood education and getting them that kind of information. We're getting them the right information like you have through WIC and making sure that they have good nutritional pieces. We're working with the parents to make sure that they bring their child in for immunizations and well child care. It may be helping them with transportation. It may be helping them finding appropriate housing. All of these things contribute to health. So I think that's a good example of what we talk about, the social determinants of health.
Yeah. And all this is critical in prevention.
Yes.
Before it becomes a crisis and they need intervention. Yeah.
Precisely.
Yeah.
Yeah.
Well, are there any last-minute thoughts that you might want to share with the audience?
Well, I think public health is on the move. I believe that we have a department that's very passionate about public health. We're very, very dedicated. We want to use the science tools that we have, but we also want to use the new technologies that we have today to improve our ability to reach out to people and to touch their lives and to improve it. We really want to have these foundations for healthy generations.
Well, thank you, Director, and thank you all for joining us today. For a transcript of the show, please go to www.hawaii.gov/DOH. Now join us again next time on Foundations for Healthy Generations. Ahui ho!
Gotta get up, it's a beautiful day. Lucky that we live Hawaii. 24/7, 365. Swimming in the ocean anytime.